So we're going to go along and to our first session, which is called Making Your Kidney Plate: How to Choose the Right Foods for Your Kidney Diet, featuring Dr. Melissa Prest and Megan Gutierrez. Dr. Melissa Prest is our very own foundation dietitian. In this role, she focuses on nutrition education for individuals at risk for and/or diagnosed with chronic kidney disease. Prior to working with NKFI, Melissa practiced in a dialysis center providing medical nutrition therapy for individuals treated with renal replacement therapy. Dr. Prest holds multiple local, state, and national volunteer leadership roles with the Chicago Academy of Nutrition and Dietetics, the Illinois Academy of Nutrition and Dietetics, the Illinois Council on Renal Nutrition, the Renal Dietitian Practice Group, and serves as a national media spokesperson for the Academy of Nutrition and Dietetics. And Megan is a board-certified renal nutrition specialist. She has been with Northwestern Transplant Center for 5 years as the outpatient dietitian for kidney, liver, and pancreas recipients and donors. Her greatest food accomplishment has been keeping her sourdough starter alive for 2 years and going. I'd love to hear more about that, but I guess we're not going to hear about that today. But go ahead and take it away, ladies, Melissa and Megan.
All right, thank you, Monica, and good morning. I will pull up our PowerPoint. All right. There we go. All right. And I'm gonna minimize myself because it's a little weird to look at yourself talking on the computer. So good morning. I am Melissa Prest, and I'm happy that I can chat with everyone today. So we are going to talk about the kidney diet through the stages of chronic kidney disease. So Megan will be covering the transplant portion, the getting ready for transplants and post-transplants, and then I will cover the earlier stages. So our goals for working with individuals with kidney disease when we look at the diet is to slow or stop the rate of progression of kidney disease. We want to make sure that you're able to maintain good nutritional status or just good health in general. It's really common as kidney disease progresses for people to not feel very well, to not eat very much, to lose weight. And so we just want to make sure that we're able to maintain your health and wellness. And another common side effect of the kidneys progressing is just as part of, like I said before, the not feeling really well, but some of that's just from the waste that's building up in your blood because you're not able to produce enough urine to eliminate that. And so that might cause some fatigue, some nausea, some vomiting. So we want to try to prevent or minimize those side effects. So generally in the first and second stage of chronic kidney disease, you'll see from the picture here that you have fairly normal blood flow that's being filtered through the kidneys. You might start to see a decline in that second stage. And what we're really focusing on in stages 1 and 2 is that we are focusing on any of the health conditions that may have contributed to the kidney disease from starting. So that might be keeping your blood pressure in check, keeping the blood sugars in goal. So we really want to focus on the chronic health condition management that is contributing to the kidney disease. And then you'll also notice from this picture that by the time you get to stage 3 and 4, how much blood is being filtered by the kidneys really decreases. And so because of that, we do some modifications to the diet to help your body do what the kidneys would normally do by filtering out these waste products in your blood. So if we think about stages 1 and 2, we're really just following a healthy lifestyle. And as I said before, we're going to focus on if there's certain diet changes or things that have been prescribed to control something like high blood sugars or high blood pressure. So one of the diets that you may have heard of that's commonly prescribed is the DASH diet. That stands for Dietary Approaches to Stop Hypertension. And so this diet is really rich in non-starchy vegetables. So we think of salads or broccoli, cauliflower, peppers, and fruits. And this is because it's really high in potassium and magnesium, which has been shown to help control blood pressure. The other change with the DASH diet from the standard American diet is that we don't focus so much on having meat as the star of the plate. We have a smaller portion of meat, which really is more like a normal size portion of meat, where you have about a fourth of the plate, and that would probably be your 3 to 4 ounce portion of meat. And then you have your starchy vegetables, so like a sweet potato or whole grains like rice, something like that. And you want to try to make at least half of the grain servings that you eat every day to be whole grain servings. And you'll kind of see on some of the other information on this picture here, we want to try to go with a cup of leafy greens, or a half cup of raw or cooked would be the serving. You have your 1 ounce is a serving of a grain or starch, an ounce is a serving of lean meat. And so those are pretty common serving sizes that we would see. Now, not to be confused, not to eat 1 ounce of protein, but just that's kind of what a standard serving of protein is. And so this could be an example of what the DASH diet would look like in practice. You'll see on the plate, you have about half of it is going to be filled. You have some chopped up sweet potatoes here. You have some bell pepper, a little bit of onion. You have some beans, which are a good vegetable, plant-based source of protein. We have some melon, and we have some starch with some toast, and then 1 egg for a protein. And this would be a lunch or dinner plate. So you'll see here, we have a bunch of vegetables on the plate. You have some potato for starch and some meat. Another diet that you may have heard about, or maybe the doctor has said to try this diet, is the Mediterranean diet. So again, thinking through that these are common diets that would be prescribed in those earlier stages of chronic kidney disease to help just for overall health, and then helping to manage those chronic health conditions. So with the Mediterranean diet, we see exercise is really important in there, just getting some daily physical activity. This diet also is predominantly plant-based, like the DASH diet, and it really includes those whole grains, your fruits and vegetables. It also focuses on healthy fats like avocado, olive oil, nuts, and seeds. It actually minimizes meats and sweets, so those are your kind of less often foods. And then some regular amounts in moderation of dairy foods, eggs, poultry, and then fish and seafood at least twice a week. So in practice, we might think of something like this for the Mediterranean diet, where we have a salad on the plate. We have lots of good salad greens. We see olives in here, which would be a fat. And yes, you can get lower sodium olives because they tend to be a little bit higher in sodium. But we see some nice leafy greens on the plate. We see some oily, kind of like an olive oil dressing over our meat. So this would be a good example of like a Mediterranean plate. Now, as we start getting into, we start going to stage 3, or we start learning about the kidney diet, these are some of the core components of it. So we want to make sure that you're eating enough. And we want to make sure you have the right amount of protein. If you are someone who is being treated with dialysis, you know that you are being asked to eat a lot more protein than maybe you were before you got onto dialysis. And before you get onto dialysis, you're probably being asked to eat less protein. We want to make sure that we're watching how much salt that we are using, and either on our plates when we're cooking or in the foods that we're purchasing. And then we want to watch out for some minerals. We have phosphorus and potassium. So the phosphorus, we kind of think about that with our bone health, but too much phosphorus can be a problem for our bones and our arteries and our heart. And then we have another mineral, potassium, which works out with our muscles and our hearts. So we want to make sure that is also under control. We also have watching how much fluid that we're drinking. If you think back to that earlier picture of how much blood is being filtered through the kidneys, obviously less blood is being filtered. We're producing less urine, we're going to have a tendency to increase how much fluid that we're actually potentially storing. So we might see fluid stored around our heart. We might see fluid kind of build up under our eyes. We might see it in our wrist or our ankle. So we want to just be careful of how much fluid sometimes we're drinking, or even some of the foods that have high fluid contents if we're starting to have an issue with having too much swelling. And then micronutrients are just vitamins and minerals. So those are obviously in all of our foods. We want to make sure that we are getting enough of those. So in stages 3 and 4, this is when we start to look at amount of protein and type of protein that we are eating. And then we may start limiting high phosphorus foods. I generally like to talk about phosphorus additives with individuals, regardless of the stage of chronic kidney disease. And the reason for that is that the phosphorus that occurs in our foods, we don't necessarily absorb all of that phosphorus. So some of it we will, some of it we won't, but things like phosphorus additives. So if we think of a cola, those are about 90 to 100% absorbed. So what I like to encourage people to start thinking about is the foods that they have that have additives in the foods, and trying to cut back on those, or finding alternatives that don't have the additives is kind of that first step for phosphorus management. And then potassium. So there's actually a lot of really exciting research that's been coming out about potassium and how we should treat high potassium foods. So I think in the next few years, we may be starting to see some different recommendations on what we do with potassium. But in general, what we've historically done is if someone starts to have an elevated potassium level, we generally ask them to make some swaps with the potassium-rich foods, where instead of having, say, a banana, we say have an apple instead, because of the difference in potassium content. And so this is a diet that's been studied in people who are on stage 3 and 4. You will notice the theme of all these diets this morning, that they're all really making plants the star of our plate and kind of getting away from meat being the star of our plate. This is not to say that everyone has to be a vegetarian or vegan. All it is that we want to increase the amount of plant foods that we're having in a day, and kind of just cutting back on the portions of meats and animal-based proteins. But with this diet, what they studied and kind of some of the recommendations, and again, this is for people that are in stages like 3 and 4 of chronic kidney disease. And we generally encourage protein foods that's a little less than maybe what we would recommend for someone that's just that doesn't have kidney disease and for sure is not on dialysis. So we would normally say about the size of the palm of your hand would be roughly a serving size of protein. And then with this, we might say maybe 3/4 of the size of the palm of your hand, or half, just depending on how much protein you should be having in a day. We want at least 50% of the foods on your plate to come from plant sources, which if we think back to that DASH plate, it's pretty much in line with that. Limiting sodium. Now, this is a little higher sodium than maybe you are typically used to seeing or have been told by your provider. And we want to increase fiber. I think one of the negatives of sort of these earlier kidney diets, when we've talked to patients, is we've really done everyone a disservice by saying, let's take away all your high fiber foods, and you're going to have all these like white rices and white bread. And I think now, based on research and kind of we're evolving back into, let's make sure we're continuing to incorporate high fiber foods. And then calories, we want to make sure, again, you're eating adequate calories. So how could this potentially look? So instead of having pasta with maybe a red sauce or even like a white sauce or butter and something like that, we have pasta and then we top it with a whole bunch of vegetables. So we have bell peppers in here. We have some, it looks like we have green, yellow, and red bell peppers, some basil. I'm seeing some olive oil on this. There may be a little bit of tomatoes in here. So, but we're seeing that we have a lot of vegetables that is mixed in with this pasta. And so now if someone starts dialysis, or you're at stage 5 getting ready for dialysis, so depending on where you're at, so as I just said, we have lower protein before we get to dialysis, but once we get on dialysis, we want to make sure that we're increasing the amount of protein that we're eating. And the reason for this is that we want to replace any of that protein that's lost during treatment. So all of those dialysis treatments, we lose some of our vitamins and minerals and protein. So we have to add that back through our diet. Some people may be on a renal specific vitamin that really just adds back the water soluble vitamins. So that would be your B vitamins, vitamin C. And then we definitely really continue that phosphorus and potassium conversation and really look at how we can help you modify the diet to make sure that we're controlling that those blood phosphorus and potassium levels through the dialysis treatment, the medications that you're on, and the foods that you're choosing. And then fluid is a really big one. By the time someone is on dialysis, they typically are not making very much urine. Some are not making any urine. And so then we really have to be mindful of how much fluid that we are drinking. And so then we move to the transplant portion. And so hopefully Megan will be able to jump in here and provide some information on this. We have generally with the transplant, we want to make sure, some of the key things is obviously following those specific recommendations from the health team. And we also really are focusing on food safety in addition to managing any other complications that may arise post-transplant through diet. But food safety is really important. You have a new organ, you're at higher risk for illness and infection. And so we want to make sure that we don't have any issues through either the foods that we're eating, the way we handle our food, and so forth. So I am going to stop here, and I am going to see if Megan's able to take over.
Hey, Melissa, thank you for the
Megan.
introduction, and I'm happy to talk to you all about transplant nutrition. So we can get started with the considerations of nutrition in transplant. So, when you're looking for a transplant, if you have a transplant already, maybe you're already, considering these things, but I usually see people before their transplant. So what I am looking for, or what I am talking to patients about, is BMI is a big one. So all transplant centers have their own BMI criteria as a certain level or candidacy for getting your transplant for the surgical aspects of it and improving the healing of your surgery. They suggest lowering your BMI. We also consider your functional status, how well you're able to move around. Diet and medication adherence is a big one. And let's see here. My screen is a little bit, I'm gonna change my view a little bit. Okay, nutritional status is also something that we talk to patients about, how well you're able to meet your nutrient requirements. And then finally, we also talk about, your transplant diet and that food safety that Melissa just mentioned. Next slide. So first, we'll talk about body mass index, which is BMI. As you know, it's just a ratio of your weight and your height in a number form. So body mass index can increase with your weight increasing, or it can also increase with your height decreasing. And it's just one thing that I want to point out that is important to consider, because with kidney disease, there's also a bone component to that. Bone disease is associated with your kidney health. And so it's not uncommon for patients to lose height or to lose stature. So that you may consider, I was always 5'5" as an adult, but later in life, you're maybe might 5'4" or 5'3.5". So your BMI is affected by your height too, just so you know. And if your BMI is over a certain number for transplant, then we work with you to get that BMI lower by working to lower your weight. And then if needed, definitely transplant dietitians are available at each transplant center. So consult with them or ask to meet with one if you don't have them on your schedule. Because I know that I'm only, meeting with certain patients at a BMI level as opposed to maybe other transplant centers who meet with all of their candidates for a transplant. So just know that a dietitian is available if needed. Next slide. And so here are some things that I always go to for weight loss advice. Number one is cutting back on sugar in form of fruit juice and soda. It's a huge calorie savings right there. And you're not losing any nutrients by doing that. So it's a big one that I just kind of tend to first. And then as Melissa was pointing out, making fruits and veggies your main part of the meal. It's not about taking away foods, but really adding to your plate nutrient dense foods that are also low in calories. Eat slowly. I know that this is maybe something patients don't necessarily have to consider all the time, but some people just eat so quickly that they don't necessarily take the time to recognize that, oh, food is in my stomach, and it takes your brain a little bit of time to catch up with that, about 20 minutes or so before going back for seconds or filling up your plate another time. Eating more slowly, being more mindful about your eating habits can really help you enjoy it more and then also eat less. Other tips for weight loss is maybe just being prepared, keeping snacks on hand, and then checking in for your emotions of why you are eating. A big one too. Next slide. So this is about functional status. You want to check in with your strength, your energy, your activity. Those are all components of your mobility. We really just encourage you to think about your muscles. Underneath all of the fluids, underneath all of the weight gain maybe is your muscles. So we really want to keep it. It's metabolically active tissue. It's something that's going to keep you strong and your immune system healthy. So that is something to work with a therapist if you're concerned about your muscles. Next slide. Diet and medication adherence, that's a big one if you're on dialysis, of course, to keep all those labs, protein, potassium, phosphorus, fluids, blood pressure, all within that normal range. So know your numbers, know the range that they need to be in. It's important to show compliance, and especially because you're getting a new kidney, you're getting a new organ that is, if you take care of yourself, we know that you are going to take care of a new organ too. Next slide. So nutritional status, like components that go into that is your digestive system. Think if foods are tasting weird, you're having taste dysgeusia, your appetite's low, maybe you're losing weight unintentionally because all those uremic toxins are building up, and you're not eating as often or as much. Maybe you're having problems with digestion and food absorption. So if any of these apply to you, then you want to work with a dietitian to improve your nutritional status. And then finally, transplant education, just learning about the food safety aspect right now, learning about common food-drug interactions that you may have to avoid after a transplant and what those are. If pomegranate or grapefruit are a regular part of your diet right now, working towards moving away from those, just kind of get in the hang of things with your diet. And then learning about the heart healthy diet guidelines, and there's lots of ways to comply with a heart healthy diet. As Melissa was just pointing out, some of the diets that are appropriate for that are more plant-based. And then learn how to cook or cook-ish. And I like to point cook-ish is like opening up a can of tuna, making toast, heating up a bowl of oatmeal. Like cooking, it doesn't have to be this whole big ordeal. It can be pretty simple to prepare some meals for you that are at home and healthy for you. So next slide. Other transplant nutrition considerations, we're looking at your whole body, your bones, your heart, of course, your kidney, your weight, and blood sugars too. So these are all the nutrients of concern that will be monitored and adjusted after transplant. I maybe won't get into all the details right now, but just know that there's lots of things that you can consider nutritionally in your diet that affect multiple aspects of your body that are nutrient considerations. Next slide. So here I just listed out some meal examples, and then in the parentheses, you'll see the post-transplant or the food safety aspects of that each food. So if you generally eat raw egg whites, which I hope not, but after a transplant, you'll have to cook them until firm, because then you're sure that they're free of any unintentional like foodborne pathogen. And then all your dairy products being pasteurized is important too. Next slide. Here, and for lunch, you're gonna, mix up your salad greens. It's okay to have raw vegetables, but you have to do the due diligence and washing them thoroughly, and even before slicing into a vegetable too. So if you're eating a cucumber, for instance, you got to wash the outside of that cucumber before slicing into it. Cooking your salmon thoroughly, cooking your chicken thoroughly here is another example. And here's an evening meal. And then finally, we can go into some snacks next. Anything I wanted to mention here probably would be the yogurts, of course, like your milk is going to become from a pasteurized source, and then washing and, your carrots and celery before slicing too. And that's all.
All right, thanks, Megan. So we are going to take questions. I'm going to open up the chat, and let's see, we have. Will the slides be available? So I mean, I think we're fine sharing our slides. I'm sure they will be made available. Okay, never mind, that was answered. Okay, what diet is recommended if you have been high potassium and low magnesium? So I'm assuming that means that your potassium levels have increased and your magnesium levels are lower. So I can start, Megan, if you want to add anything in. But typically, our potassium, what a lot of times I always encourage patients is we're not no potassium diet. So we want to make sure that we are still eating potassium foods. We just may have to either modify the amount of them, or we have to modify which ones that we are still eating. So you can still get foods that have magnesium in them. So nuts are probably a pretty typical one that I can think of. Nuts also are higher in potassium, but if you have the appropriate portion of nuts, you can increase your how much magnesium that you're eating, but you're not going to be adding to this overall potassium load, so to speak. With that, the other thing to think about too is talking with your provider about any medications that you might be on that might be causing a higher potassium level. If you're frequently constipated, that can also cause a higher potassium level. So it may not just be the foods that you're eating that are contributing to that higher potassium level. Megan, anything you wanted to add to that question?
Yeah, post-transplant, these nutrients are commonly off or under or in a deficiency state. So if we can't get to it through foods alone, like Melissa was mentioning, we'll add a supplement if needed to, increase magnesium or increase potassium. So lots of these nutrients are just an individualized basis and case by case.
Thank you. Is it better to do a combination diet if you have an egg and seafood allergy? I don't know if I 100% understand the combination diet, but in general, you want to make sure that you're making your plate with a protein source, a carbohydrate, a fat source as kind of a minimum. So if you have allergies, typically as a dietitian, we would work with you to make sure that the foods that you aren't allergic to can be included into your everyday plate and diet. So I'm not sure if this is like thinking about food combos, like don't have fruit with a protein or something to that effect. I know there's some information out there with that. I think one thing to think about with just combining foods, I always think about is with blood sugar control. So we know that if you have something that is just you know, like say it's a piece of fruit and you, it's going to cause that increase in your blood sugar level. But if you pair that piece of fruit with, say, some nuts, or maybe you had some sliced some sliced bananas on a slice of toast with some peanut butter, the increase in blood sugar is not going to be as quickly as if you just had a piece of fruit. So, you know, that's something to kind of think about when you're looking at just food combinations. We want to make sure, again, that you're getting proteins, fats, and carbohydrates. And then we're always trying to modify and work around allergies. So, Megan, I don't know if you have anything to add to that one.
You're good.
Okay. So we have some transplant questions. Okay, the high dose calcium and vitamin D3 I am on post-transplant has led to severe constipation. What is the best form of fiber I can have, and is it wrong to overdose on fiber? So Megan, if you want to start that one.
Overdosing on fiber, you're just going to increase bowel movement frequency. So fiber is not absorbed; it's going right through. It is going to exit, you know, and add bulk to your stool. So I'm not sure. Overdosing on fiber, you'll feel like bloated, discomforted. Digestive systems will be altered in that case. But constipation for food. You know, dried fruits are a really great source of fiber if you need them. There's lots of fiber in fresh fruits too, and certain ones. So, you know, like pears are a great source of soluble fiber, oatmeal, like, and different sorts of like seeds too can help add more bulk to your stool, like and ground up flax seeds. So all in all, I think it's more of like a combination of all of those foods together rather than just focusing on one food or eating too many dried fruits at once, because you don't really want to overdo it on any one particular food to fear of like increasing your potassium.
Thanks, Megan. And we are actually at our time for our presentation. So I know there's a lot of good questions. So I will kind of be going back through right now, and Megan can go back through and we can answer them in the chats. But I do know we have to move on to the next presentation. So thank you so much, Megan. And thank you everyone for joining us and having some great conversation.
Yeah, thank you for having me be here.
Thank you. That was fantastic. What amazing and helpful information. We know that health and nutrition is the key to living a healthy life with kidney disease, no matter which stage you're at. So thank you, Melissa and Megan. And I just want to let everybody know that Melissa is available for one-on-one consultations. Just call our office and schedule an appointment, and she can answer your questions directly. That's one of the wonderful benefits that we have to offer to you. So make sure to take advantage of that.